Back in March 2020, Imperial College London predicted COVID-19 lockdowns would save more than 2 million lives in the United States, but a new study finds they prevented just 4,000 deaths in the U.S. while imposing severe economic and social costs. The study authors label lockdowns a global policy failure of gigantic proportions. NTD's Jane has the details.
Stay-at-home mandates, closed businesses, and confusion over complicated rules. Lockdowns might feel like a distant memory, but did they really work? Researchers from Johns Hopkins University and Lund University sifted through almost 20,000 studies on COVID-19 restrictions across different countries. They concluded lockdowns failed to significantly reduce COVID deaths. However, co-author of the study, Jonas Herby, says voluntary changes in behaviour did have an effect.
So our study doesn't say that social or physical distancing doesn't work. I truly believe that it works when there's a pandemic. It just shows that what people do voluntarily is the main effect you get. And then what the states can do on top of that is very limited.
Imperial College London modelling in early 2020 predicted lockdowns would save more than 2 million lives in the US and over 400,000 lives in the UK. But this study concluded lockdowns prevented only 4,000 deaths in the United States and 6,000 deaths across Europe. That's relatively few deaths compared to a typical flu season. The study authors call COVID lockdowns a global policy failure of gigantic proportions. Professor David Payton says the costs for society far outweigh the benefits.
We know they have very, very large costs. Now we might, excuse politicians who are panicking a bit, perhaps early in the pandemic and trying to follow suit across countries. But looking back, I think it's reasonable to say that those lockdowns and government interventions were a really, poor policy intervention in terms of the low benefits and high costs that they had.
When lockdowns were being implemented, UK lawmaker Sir Graham Brady was one of those who raised concerns.
Now we're seeing the results of serious academic studies suggesting that the amount of good done by lockdowns was virtually none at all. We are nonetheless every day seeing evidence of the massive harms that were caused in other aspects of people's lives.
He said lockdowns have had a particularly serious impact on children and young people.
Young people going to university and not being allowed to attend lectures and having to do everything virtually and online. These have got very real consequences, both in educational performance outcomes and also in terms of mental health for young people.
Imperial College London didn't respond with a comment. Jane, NTD News, London.